On to talk of the nation. Now, medical have one that policy could trigger a staffing public hospitals. The reforms threaten welfare, patient future of Uganda's health. I am joined by Dr. Joseph, who is president of the Medicans Association. Good evening. Thank you for joining us.
Thank you. My name is Dr. Joseph, and I'm the current vice interns in Uganda. Yes. All
right. So, with for the benefit of especially those that have not following what is going on, the interns exactly is contained in the city, and why the interns oppose.
To begin with, every other policy has it has the problem statement, has the implementation, it has the vision, it has, and it also has a monitoring and a section. But with this policy, specifically the problem statement, ministry that we have challenges. These are the challenges they mention. They say that we are having very many interns because approximately 2,000 are deployed every year. They mentioned a challenge of internship centers, and they mentioned have about 58 centers. They mentioned that we have few spots. So why we are dissatisfied with them? One is policy is unfair in terms of what? I think I need our viewers understand what intern is. People who have done things like maybe social administration, so do internship, 1 month or 2 or so. Their question is, are they saying these interns specifically? Why are they saying they should be paid for us? We are not paid. So that's why I want to understand that medical intern is somebody who went to medical school for 5 years. Previously, this policy came in, so it's supposed to be a degree of medicine, of bachelor of surgery, then they can go postgraduate training. Why we are having it is that we call them because of lots of less vocabulary. Not just since we are supporting them postgraduate trainees. Doctors. That is why, for example, in the United Kingdom, called foundation doctors. In the US, they are called physician. They are called houses.
Okay. So disagreeing with is or that as interns, is it that they interweave in this policy?
I am not disagreeing with the term. I am disagreeing with the fund ministry that these should not be given allowance. Number two, ministry is saying that this should first do it before they can receive a degree.
Well, with the permanent secretary of health, Dr. Diana Twin, this very issue, and we have a clip of her actually in the ministry stand at the point that the interns take a listen.
We don't want to. We went through the other time to wait for a whole year. We invest more in making sure that more training centers, so that we don't crowd few centers and plan enough. We need and hire specialists. If you support government must continue to pay you allowance for that period and intern. If you have been a private person, the person has been taking you for that 1 year, extended 1 year. That's that. What was not is to pay money, because keep on increasing. And that's why we're getting strikes, because the money will not, even now, I don't know, to pay these that are finishing, we are supplementary to you cannot, because we don't have alternative. We go through what we.
The permanent secretary responds to that.
So my is that I don't know who implementing these policies done some bit of help, because actually the issue is about something the cost benefits. First of all, we need to understand what are the benefits of prolonging graduation. Do the benefits of that we shouldn't pay in time outweigh the cost? The amount of money it pays in medical school, about 50 to 100 when you go to private. So the question, why should we financial burden of sold land has sold to educate somebody in at the end of it all, saying there is no allowance, and put the burden on.
You know, there is when the interns withdraw, offering their patients at the end of the day are going to suffer. The load that they in their shoulders when they actually in hospitals, and would like of a day in an internship when they're in the hospital.
Actually, if I can answer to that, that an intern doctor, an intern pharmacy nurse, actually is between life and death. Because these interns are nurses, I'm going to give an Ebola outbreak that happened in 2022. We had a total number of 1 cases. Out of those 19 were health. Out of those 19, 7 died. But I can tell you that half health workers, and they were medical students. Then interns that they stand between, like, they are the ones who are every patient who comes, the first interface.
The intern. And so now, if you have to speak to the authority responsible, finally, as we call, what are the 3 changes that you recommend for them to make before it's implemented?
We recommend one policy, which as a draft. agree with this policy. We add an internship policy where interns are going to be paid.
That's one.
Number two, we are saying that if there is the few internships, let them create, because the policy is 58, but the current interns have 74 internships. So that was a practical solution. PN approached, private means were brought on board, and internship centers were seeing members who went to upgrade, working as the masters.
Okay.
They are specialists, but they are still working.
And finally,
and what we are saying is, we disagreeing with this policy, and that policy is passed. They should call professional councils. Uganda Medical Association, Pharmaceutical Society of Uganda, nurses, lab technicians, all of them have even understanding the policy.
Okay, thank you, Dr. Atu, the Vice President of Medical Interns Association, to share with us this on the new policy proposed by the government.